Hello friends, welcome to Self 24 IAS. In this lecture video, we are going to solve the question number 11 of Opsc Preliminary Examination 2021. We have already solved question number 1 to 10. This is question number 11. Now before moving forward into the discussion, we want to thank all our viewers who have made our last video successful, which has crushed 1000 views, which is currently running at 1400 views. Okay, so we are thankful to all our viewers for that video and the support they have given to us. Now question number 11. Question number 11 is a fact-based question which talks about the sex ratio at birth for the Indian population as per National Family Health Survey 5. The answer is option C, 929. Okay. If the question would have given National Family Health Survey 4, the answer would have been 919. As the question says National Family Health Survey 5, what is the sex ratio at birth as per National Family Health Survey 5? The answer is option C, 929. Now talking about the detailed answer. What is National Family Health Survey? Okay, the National Family Health Survey or NFHS is a large-scale multi-round survey conducted in a representative sample of households throughout India. That means it's a sample survey. It's a sample survey of households regarding health and family welfare issues. Okay, data are conducted by the organization. Which organization? It is conducted by the International Institute of Population Sciences, Mumbai. Okay, which is the nodal agency for providing coordination and technical guidance for the survey. The Ministry of Health and Family Welfare India has designated the International Institute of Population Sciences Mumbai as the nodal agency for providing coordination and technical guidance for the survey. How IIPS Mumbai collects the data? IIPS Mumbai or International Institute of Population Sciences Mumbai collaborates with a number of field organizations for implementation of the National Family Health Survey. Goals. What are the goals of National Family Health Survey? Goals. Each successive round of National Family Health Survey has two specific goals. Number one, to provide essential data on health and family welfare needed by the Ministry of Health and Family Welfare and other agencies for policy and program purposes. That means government is implementing different policy and programs for improvement of the quality of health life of Indian citizens. Okay, for that it needs data. Okay, or essential data. That essential data is provided by the National Family Health Survey. Okay, so the objective number one or the goal number one is to provide essential data on health and family welfare needed by the Ministry of Health and Family Welfare and other agencies for policy and program purposes. Okay, for formulation of new policies, new programs and improvement of the existing policies and existing programs. Okay, so number one is policy and program purposes. Number two, to provide information on important emerging health and family welfare issues. That means in India, suppose in the Indian society there are different emerging health challenges are there. Okay, or different health challenges are emerging currently in the society. The government must have the information and the data to formulate policy, formulate policy and progress and to tackle that emerging health challenge. Okay, suppose for example a new virus came which caused a pandemic. Okay, and because of the pandemic different classes of the citizen or different citizens are dying. Okay, the government must have these data in advance so that while emerging or when the situation emerges or when the virus emerges, government will be able to tackle it. Okay, and for that government needs to plan in advance. For that government needs data. That data is provided by National Family Health Survey 5 or National Family Health Survey. Okay, that's why the goals are twofold. One is for policy and program purposes, second for important emerging health and family welfare issues. Okay, then on which areas this information are provided? National Family Health Survey provides state and national information for India on what are the areas? On fertility, infant and child mortality, the practice of family planning, maternal and child health, reproductive health, nutrition, anemia, utilization and quality of health and family planning services. Okay, these are the areas on which state and national information are provided by the National Family Health Survey. Funding. Okay, historically the funding of National Family Health Survey has been provided by these agencies. Okay, USAID, the United States Agency for International Development, the Bill and Melinda Gates Foundation, the UNICEF, United Nations Children's Fund, the UNFPA, United Nations Population Fund, and Ministry of Health and Public Welfare, India. Okay, history of NFHS. Okay, history of NFHS. Objective is the main objective of each successive round of National Family Health Survey has been to provide high quality data on health and family welfare and emerging issues in this area Until now, there have been 5 National Family Health Survey or 5 rounds of National Family Health Survey. Okay, number 1, it was conducted in 1992-93. Second, National Family Health Survey 2 was conducted in 1998-99 in all 26 states of India. Okay, this second, National Family Health Survey 2 was funded by USAID with additional support from UNICEF. 3. National Family Health Survey 3 was carried out in 2005-6. Okay, it was provided by funding was provided by USAID, Department of International and Development UK, the Bill and Melinda Gates Foundation, then UNICEF, UNFPA and Government of India. 4. It was conducted in 2015 and 16 or 2015-16. In addition to the 29 states, National Family Health Survey 4 included all 6 union territories for the first time and provided estimates for most indicators at the district level for the all 640 districts of the country as per the 2011 census. So what is the speciality? All union territories are included in the survey for the first time. The survey covered range of health related issues. What are those issues? Fertility, infant and child mortality, maternal and child health, perinatal mortality, adolescent reproductive health, high risk sexual behavior, safe injections, tuberculosis and malaria, non-communicable disease, domestic violence, HIV knowledge, and attitudes towards people living with HIV. Then the survey 5 question asks about National Family Health Survey 5. Okay, National Family Health Survey 5 has captured the data during 2019-20 and has been conducted in around 6.1 lakh households. Okay, many indicators of National Family Health Survey 5 are similar to those of the National Family Health Survey 4 carried out in 1920, 15 and 16. Why so? Because to compare it over a period of time. That's why many indicators of National Family Health Survey 5 are similar to those of the National Family Health Survey 4. Phase 2 of the survey covering remaining states was delayed due to COVID-19 pandemic and its results were published in September 2021. We know during 2020 and 21 there was COVID-19 pandemic. That's why the phase 2 of the survey was delayed. Okay. Then where the data will be useful? The National Family Health Survey data 5 or National Family Health Survey 5 data will be useful in setting benchmarks and examining the progress of the health sectors which is made over a period of time. That means we want to know the progress of the health sector which is made over a period of time, that we can learn from the indicators or from the data of National Family Health Survey 5. Okay, which are the areas on which the National Family Health Survey data provides? Okay, providing evidence for the effectiveness of ongoing, that means which are the areas for which this data will be useful. Number 1, providing evidence for the effectiveness of ongoing programs, help identifying the need for the new programs with an area specific approach. Third, identifying groups that are most in need of the essential services. That means we want to learn the effectiveness of the ongoing programs or the current programs, that we can learn from data of or indicators of National Family Health Survey. Number 2, the data is also help in identifying the need for new programs with an area specific approach. That means through through the National Family Health Survey, we collect data regarding different areas of National Family Health or different areas of health and public welfare. Through that, we get to know if there is a need for new program or not. Okay, that's why the National Family Health Survey data 5 helps in identifying the need for new programs with an area specific approach. Third, identifying groups that are most in need of essential services. That means there would be some vulnerable groups in the society, there will be some underprivileged groups in the society which will not be properly served the health and family programs and the policies, the health and family benefits. Okay, the data of the National Family Health Survey helps in identifying such groups so that the government can create or government can bring the new policy and programs by specifically targeting their groups. Okay, that's why the data of National Family Health Survey 5 helps in identifying groups that are most in need of such essential services. Okay, apart from that, the National Family Health Survey 5 data provides an indicator for tracking 30 Sustainable Development Goals or SDGs that the country aims to achieve by 2013. Okay, we all know there are Sustainable Development Goals of United Nations which each country is trying to achieve by the 2030. Okay, so the 30 Sustainable Development Goals India is going to achieve by 2030. How can we do it? How far progress we have made with respect to those 30 SDGs? That we can know through National Family Health Survey 5 data or National Family Health Survey 5 data. Next, some new topics are added or included in National Family Health Survey 5. What are those? Preschool education, disability, access to toilet facility, death registration, bathing practices during menstruation, methods and reasons for abortion. Methods and reasons for abortion. Okay. It has also included, or National Family Health Survey 5 also included some new focal areas. What are the role of those focal areas? These new focal areas will give requisite input for strengthening the existing programs and evolving new strategies for policy intervention. That means the current programs must be strengthened. Okay, the new focal areas, okay, which are included in National Family Health Survey 5 will give the requisite input or the necessary input for strengthening the current programs. Second, evolving new strategies for policy intervention. That means government from time to time, okay, frames new policies, okay, for new policy intervention in the society. That new strategy can be helpful through National Family Health Service 5 data. Okay. Now we have said National Family Health Service 5 includes new focal areas. What are those focal areas? Number 1, expanded domains of child immunization, components of micronutrients to nutrients to children, menstrual hygiene, frequency of alcohol and tobacco use, additional components of non-communicable diseases, expanded age ranges for measuring hypertension and diabetes among all aged 15 years and above. Okay, these are the new focal areas which are included under National Family Health Service 5. Okay, and there is one speciality. In 2019, for the first time, the National Family Health Service 5 sought details on the percentage of women and men who have ever used the internet. We know India is going through currently an internet revolution phase, okay, by which the number of mobile users or the number of internet users who are using internet through mobile have drastically increased. That's why the government wants to collect data on people whether they have ever used the internet or not. That's why in 2019, for the first time, National Family Health Survey 5 sought details on the percentage of women and men who have ever used the internet. Okay, this particular line can be asked in a MCQ format in the examination. Next, there is also another relevance for National Family Health Service 5 data. Okay, that we will learn this time. As per the 5th round of National Family Health Service, National Family Health Survey 2019-2021, the sex ratio of the population, that is females per 1000 males for the country, was estimated as 1020. Now, Beti Bachao Beti Padhao scheme. We know this is a very popular scheme. What is the aim? The aim is to address the declining child health ratio or the declining child sex ratio. Okay, it aims to address the declining child sex ratio and related issues of empowerment of girls and women over a lifestyle continuum. What is the primary objective of the scheme? The primary objective is to prevent gender-biased sex selective elimination. This is one of the reasons of low child sex ratio. So, to prevent gender-biased sex selective elimination. Number 2, to ensure survival and protection of the girl child. Number 3, to ensure education and participation of the girl child. Number 3 is to ensure education and participation of the girl child. These are the objectives of the scheme, or these are the primary objectives of the Beti Bachao and Beti Padhao scheme. Okay. Now, then what is the relevance of National Family Health Service data with respect to Beti Bachao and Beti Padhao scheme? That we will learn. The key elements of the scheme included nationwide media and advocacy campaign and multi-sectoral interventions in some districts. Intermediary target, that is sex ratio at birth, has been set as a monitoring parameter for the progress of the scheme. This is the relevance. This is the relevance of National Family Health Service or National Family Health Survey 5 data with respect to Beti Bachao and Beti Padhao scheme. The one of the intermediary targets of the scheme is sex ratio at birth. Okay, that is the monitoring parameter for the progress of the scheme, and we can know sex ratio at birth through National Family Health Survey 5 data. Okay, as seen from the National Family Health Service 5 data, for the first time since independence, number of women in India have surpassed the number of men, which is unprecedented. That means currently India has 1020 women for every 1000 men. Okay, according to National Family Health Service Health Survey data 5. During National Family Health Survey 3, okay, it was 2000, which was conducted in 2005-6. The sex ratio was 1000. During National Family Health Service 4, which was conducted in 2015-16, the sex ratio was 991. The sex ratio. Okay. Now, according to National Family Health Service 5, the sex ratio at birth, this is something which has been asked in the examination or the question. Question does not ask sex ratio. Question asks sex ratio at birth. Okay, which has been improved from 919 in 2015-16 to 929 in 1920. Okay, so the answer is 929 in 2019-20. Okay, sex ratio at birth. Apart from that, another indicator, total fertility rate, okay, which was 2.2 during National Family Health Service 4, that has also declined to 2.0. Total fertility rate of National Family Health Service 5, which was conducted in 2019-20, it is 2.0. Next, limitations. What are the limitations of National Family Health Service 5 data? Okay, demography experts say it is not the time to rejoice, or it is not the time to celebrate. Why so? Because the figures of the National Family Health Service or the National Family Health Survey do not give an accurate picture of India's sex ratio. Okay, that do not give an accurate picture of India's sex ratio. The report itself has advised caution. National Family Health Service 5 report has itself advised one caution statement. What is that? Readers should be cautious, or readers should be cautious, okay, while interpreting and comparing the trends, as some states and union territories may have smaller sample size. That means, as you know, this is sample survey. So in some states and union territories, the number of households surveyed or the number of sample households surveyed are very less or less. That's why the readers should be cautious while interpreting and comparing the trends. Okay. So what are the total number of households surveyed? 6,36,699. Number of women surveyed? 7,24,115. Number of men? 1,18,39. Okay. Demographic expert from the International Institute of Population Sciences, Mumbai, that is the very organization which has surveyed. It says that overestimation of sex ratio in National Family Health Service or National Family Health Survey 5 was due to two major reasons. Why there were 1,020 women per 1,000 men? Because of two reasons according to International Institute of Population Sciences, Mumbai. Okay, first reason, the sex ratio mentioned in the data was based on the de facto enumeration. That means the number of males and females who were present in the household on the last night of the survey. That means the number of males and females who are not present have not been taken into account. That's why the data can be 1,020. Okay, first is the sex ratio mentioned is the number of males and females who were present in the household on the last night of the survey. Okay, this is number one reason why data is coming out as 1,020 women per 1,000 men. Okay, second reason is the significant improvement in the sex ratio in India during the last 30 years. We know during last 30 years the health services has increased drastically, or the public health services has increased drastically. That's why the improvement in sex ratio. Okay, interpreting the figures in terms of India now having more women than men was completely misleading. So expert of International Institute of Population Sciences, Mumbai, say we cannot draw a simple conclusion that now India has more women than men. Okay, so according to this data, there are 1,037 women per 1,000 men in India's rural areas. Okay, but according to expert from International Institute of Population Sciences, Mumbai, says the possibility of migrant rural men and women being away from their homes on the last night of the de facto enumeration cannot be ruled out. That's why data is coming out as high 1,020 women per 1,000 men. Okay, why? Because migrant rural men and women have not been taken into account. They may not be present at the site of the survey. Okay, they might have gone to different state for work. Okay, so the migrant rural men and women being away from their homes on the last night of the de facto enumeration cannot be ruled out. Okay, now we have learned that the National Family Health Service health survey data is a sample survey. Okay, now what is a complete survey? Census. According to expert from the International Institute of Population Sciences, Mumbai, census figures are more reliable than National Family Health Survey. This is because the entire population of the country was counted during the census and the sex ratio was then counted on the total number. So there are 933 women per 1,000 men according to 2011 census of India. Okay, now this is over. Question number 11 is over. Okay, next we will go to question number 12 in the next video. Now this is one appeal. If you have liked our earlier videos and if you do like this video, then please hit the like icon, share it among your friends, and please don't forget to subscribe our YouTube channel. Please subscribe our YouTube channel, Hassles24 IAS. Thank you. Thank you very much.